Hi, welcome to Managing and Understanding Your Cancer Treatment. My name is Chris Tucker. I'm an oncology nurse here at Stanford, and I give chemo in the infusion treatment area at the Cancer Center. This class is presented by the Stanford Cancer Supportive Care Program. We're going to skip a few slides about confidentiality and get into the goals for today. The goals for today for this class is to gain understanding and reduce anxiety about your cancer treatment. That's generally the reason people are watching this is, yes, they want to get information. Information will reduce your anxiety. So that's the goal, is to just bring the anxiety level down a little bit before you start your treatment. Okay, just to begin with, what is cancer? Cancer is the uncontrolled abnormal growth of what were once normal cells at its basic level. Cancer can start almost anywhere in the body. It's not just one disease. If you've got cancer cells in your lung, you've got lung cancer. If you've got a cancerous process going on in your colon, you have colon cancer, but that doesn't mean that it's the same disease. But the cancer cells do have some things in common with one another, regardless of where they exist. They tend to ignore the signals that normally tell cells to stop dividing, which means that they continue dividing and become more and more abnormal, even though your body is trying to stop that process. So they tend to accumulate and form what's called a mass or a tumor in most cases. That's often how people are discovering their cancer, is because that mass is causing some pain or you can feel it. And then, of course, the other thing, unfortunately, that cancer cells can do is they can spread from that original tumor site to other parts of the body. Most cells don't do that. You don't have stomach cells wandering off to start stomachs in some other part of your body, but cancer cells don't stick together as well as other cells. So that's an unfortunate characteristic of cancer cells. We call that metastasis. So what is chemotherapy? Chemotherapy is a category of drugs we use to kill cancer cells. Mostly they work by interfering with the cancer cell's ability to grow or reproduce. They slow or stop the reproduction of those rapidly dividing cancer cells. So remember, that hallmark of cancer cells, that they divide rapidly, is part of the way we've learned how to destroy them. The goal of chemotherapy. The goal of chemotherapy is to stop or slow the growth of cancer cells. Chemotherapy is considered a systemic treatment, which means we're going to put it in your body. It's going to spread everywhere your blood goes once it gets into your bloodstream. Something like surgery or radiation we consider targeted, in that surgery removes something, radiation points at a particular spot. Chemotherapy is going to treat your whole body, which is what we want, because that way we are hoping that we can find every cancer cell, even the ones that we don't, that may have wandered away from the original tumor. How will your doctor know which drugs are right for you? Well, fortunately, we've got really smart doctors. We have more than 100 different cancer drugs. Your oncologist has access to the latest research to guide him or her in deciding which treatment is best for you. They will choose drugs, doses, frequency, and duration for your treatment. And the drugs that are best for you will depend on the type of cancer, or how big it is, if it's spread, how it affects your normal bodily functions, and your overall physical health. A single chemotherapy drug may be used to treat your cancer, or multiple drugs may be used in combination. Multiple drugs with different actions can sometimes work together to kill more cancer cells. But in the end, you and your doctor will make the final decision about which drug or combination of drugs you will get. Let me talk a little bit about targeted and biotherapies before we go on, because as you probably know, when we say chemotherapy, that has grown to, we've added a different group in here, additional group that are called targeted or biotherapies or immunotherapies. They're technically different than chemotherapy, so I want to talk briefly about those before we move on to talk more about actual chemotherapy. So targeted cancer therapies are drugs that block the growth and spread the cancer by interfering with specific molecules. These are just a few examples. I'm not going to go through them, but each one of these, as you see there, has a unique way that it will target certain cancers that are susceptible to this kind of action. Immunotherapy, you probably have heard a lot about. You may have even seen some ads on TV for some of these immunotherapies. These refer to drugs that restore or strengthen your body's own immune system's natural ability to fight the cancer. Nivolumab, pembrolizumab, those are Opdivo, and Keytruda, those may be the ones you may have seen on TV. These are drugs that work by taking the brakes off your immune system so that it can kill certain types of cancer cells. So there's a lot of very exciting research going on in this area. How is chemotherapy given? Most chemotherapy goes directly into a vein through an IV or intravenous infusion, one drug at a time. We don't mix them all together in a cocktail and give them at the same time. So if you're getting 3 drugs versus 1 drug, that obviously means it's going to take longer because we have to put them in separately. Some of the new targeted therapies and a few chemotherapies actually come in pill form so that you can take them orally, but most drugs you don't have an option of IV versus oral. Chemotherapy is usually given multiple times over weeks or months in what's known as a course of treatment. A course of treatment is made up of a series of periods called cycles, and the total length of time you will be receiving your treatment varies depending on your specific type of cancer. I'm going to stop a little bit here to talk about venous access devices, and these are sometimes options. Patients may know about these. These are semi-permanent devices that will allow us to draw your blood and give you chemotherapy without having to poke you with a needle every time. Clearly, this is a conversation that you have with your physician, but just so that we're here, since we're here talking about this, I thought I would tell you a little bit about them. Most of the time you hear about ports or mediports, and you can see in that top center picture, she's holding what the port looks like before it is implanted. It's about the size of a penny. On my right, you'll see a schematic of a person who has one implanted, and you can see how that port is implanted just under the skin in your chest, and that IV catheter is threaded through a vein in all the way. It looks like it's going all the way into your heart. It doesn't actually go that far, but it gets very close. We want it in a really big vein, and then we stitch up that little incision that we made to put that port in. Then when we need to draw blood or give chemo, you can see the lady on the left, on the top. That's what it looks like when it's implanted, so there's nothing sticking out of your body. On the bottom, there she's got a needle in it and a little dressing over the top, and that's what we would do to access it if we were going to draw blood or give chemotherapy. The other pictures in the center are what's called a PICC line, which stands for a peripherally inserted catheter. Those are done in your arm, and they're much easier to install. They're short-lived, but they do mean that you have catheters actually exiting your arm there, which means you have to have a dressing, which needs to be changed every week, even if we're not using it, whereas a Mediport, you don't have to think about it at all. So again, I'm not saying these are options for everybody, but if you have difficult veins, or you're very worried, very scared of needles, or your physician has recommended one of these, this is a little bit about them. So again, this is a conversation to have with your provider. Okay, how will I know if my chemotherapy is working? You'll usually have blood tests and see your doctor before each cycle. During these visits, your doctor will examine you, ask you how you feel, do a physical exam, answer any questions that you have. Most of the time, the blood tests that we're doing won't tell us a whole lot about how your cancer is responding to its treatment. Sometimes there are certain things that we can tell and how the blood results change. We're mostly checking to see whether or not your blood reflects your ability to have your next round of chemo, probably on that day. We'll talk about that a bit more in a minute. The main way that we know whether your chemotherapy is working is when you have intermittent MRIs, CTs, or PET scans. Usually, say, halfway through your treatment, we want to check to make sure that the chemotherapy is working so that we know that if it's not, we need to change direction before we keep going. And if it is, we go yay, and we finish it up and then do another one at the end to make sure that it's working. Just a little bit about side effects, which we're about to go into. Severity of side effects has nothing to do with how well the chemotherapy is fighting your cancer. So some people feel like because I feel terrible, that must mean the chemotherapy is really working. Or then people say, I'm not having any side effects. I don't think the chemotherapy is working. Neither of those are true. So just keep that in mind as you're going through your treatment. Are others at risk of exposure to chemotherapy by being around you? In some ways, it takes about 48 hours for your body to break down and get rid of most of the chemotherapy drugs. During this time, a small amount of chemotherapy may come out in your urine, stool, vomit, or other bodily fluids. So it's only that 48 hours after you've gotten your chemotherapy that there's a slight chance of there being a little bit of chemotherapy in your bodily fluids. What we recommend at home is after you use the toilet, you flush it twice. Men, if you can sit down while you're urinating just to prevent any kind of splatter. Clearly washing your hands with soap and water when you're finished. If you do vomit, we're going to clean out that, empty that into the toilet, flush it twice. Use condoms during sexual activity, and gloves when handling trash or laundry that has come in with bodily fluids. Hugging and kissing is safe, even with kids. We don't want to tell you you can't hug your kids, and it's okay to share a restroom with somebody else. You don't have to have your own separate space. And again, these precautions are only necessary during the first 48 hours after the most recent dose of your chemotherapy. If you are on oral cancer drugs, which a lot of people will be now these days are on a combination, make sure that you talk to your provider about how to take those medications. Usually it's with a full glass of water at the same time every day. Make sure you know when to start, how many you should take, how many days you're on, should you take it with food or without food. Usually we don't want you to break or crush chemotherapy pills. And if you miss any chemotherapy doses for some reason, make sure you contact your provider to find out what to do. We don't want you to double up without checking with your provider first. As far as handling oral chemotherapy drugs, there could be some chemotherapy residue that could get on your own hands for touching them with your hands. So we want you to wash your hands with soap and water after handling. Wear protective gloves if you're actually handling the medication. Sometimes you can get it from the bottle into the cap of the bottle or medicine cup, and it doesn't have to touch your hands at all. Don't throw away any unused medicine in the garbage or down the toilet. There are proper ways to dispose of that will help you with, and clearly keep these drugs away from children, pets, or anyone else who might touch them. Clearly, we don't want them getting in the hands of kids or pets. Okay, why does chemotherapy cause side effects? This is what we're going to talk the most about. So, depending on the drug, the side effects can vary greatly. So if you know someone who's had chemotherapy and felt that way, that doesn't mean that now you're having chemotherapy, so you're going to feel that same way. The chances are very high that their drugs were different than yours, you're a different person than they are, so we need to approach your particular side effect profile as not only just the drugs you're taking, but you the individual. Do know that some people have no side effects at all. Partly because we have very good drugs these days to prevent side effects, primarily nausea. We're very good at preventing nausea. Okay, there are some chemotherapy that chemotherapy kills rapidly dividing cells. There are some side effects that result from the effects the chemotherapy has on normal cells that are also rapidly dividing. So this is a bit of an issue when it comes to things like hair loss, bone marrow, your GI tract, your skin, and your reproductive organs. Turns out the chemotherapy sometimes can't completely tell the difference between the rapidly dividing bad guys and the rapidly dividing good guys. Okay, the first side effect we talk about is fatigue. Fatigue being that sense of tiredness or exhaustion that just gets in the way of your normal functioning. I mentioned this first because this is the most common complaint of people who are on all kinds of chemotherapy. And even some of the immunotherapies we're finding are making people feel quite fatigued. So in terms of anticipating what you're going to feel like, anticipate that fatigue is going to be with you while you're going through treatment. It's caused partly by the drugs themselves. If you think about these very powerful drugs that are fighting a very intense battle in your body, it takes a lot of your body's energy just to allow that process to happen. You might become anemic, which means you don't have quite as many red blood cells as you normally do. We'll talk in a minute about why that happens. If you're dehydrated, you're not eating well, those things add to fatigue. If you're stressed, we all know that stress and not getting enough sleep adds to fatigue. And then pain or taking pain medication can also add to fatigue. To be clear, chemotherapy itself does not cause pain. Some people worry that they're going to have pain because of the chemotherapy, and that's not the case. In terms of treatment for fatigue, honestly, the best treatment against fatigue is exercise, which I understand sounds counterintuitive, but it turns out that if you are able to get some regular exercise, even if it's just walking every day, that will help you sleep better at night so that you will be awake during the day. Plus, it will keep you a little bit in shape so that when you're done with all of your chemo, it won't take you as long to get back to your normal functioning again. Good hydration, good nutrition. I'll say hydration again and again in this class. Think of half a gallon of water of some kind of fluid every day. If you're not a good water drinker, now is a good time to become one, whether that's 4 little plastic bottles of water or 8 cups of some kind of fluid during the day. Keeping yourself well hydrated is a great way to take care of yourself. Good nutrition, we'll talk briefly about that. Relaxation exercises, if you are stressed, yoga, some of those exercises are very gentle and very relaxing. If you're really anemic from your chemo, we can give you a blood transfusion, but of course, we're trying to do as little as possible as you go through this. But clearly, if we look at your blood counts and your red count is low, you will feel better if we give you a blood transfusion. I do like to point out that fatigue is cumulative, which means the more treatments you have, the more fatigue you're going to feel. So between cycle 1 and cycle 2, you may be tired right about in here, and then you start to feel better, and by the time you get to the next cycle, you're good. That might happen between 1 and 2, and 2 and 3, but after 3, people say they get more tired, it takes longer for them to get back to normal, and they don't quite get all the way back up to normal. And I think this is good to know in terms of whether you are planning some things or you have some activities coming up or you want to spend some time in your garden. You're going to feel more like doing things the first part of your chemotherapy treatment than the last part. You won't I'm not guaranteeing you'll feel really tired at the end, but there's a chance that you will. So I'd just like you to be prepared in case that happens. Okay, this one, chemotherapy effects on the bone marrow. So it turns out most of your blood cells are made in the marrow of your bones. And blood cells don't live as long as other cells in your body, which means in order for your body to maintain a constant number of cells, the healthy number, your bone marrow is constantly making new ones as the old ones are dying off. That's a perfectly normal process. It's going on all the time. Unfortunately, when we put that chemotherapy in your bloodstream or it gets ingested in your stomach, that chemotherapy is going to be in your blood. It's going to come in contact with all the cells in your body, which include your bone marrow. So when the chemotherapy hits the bone marrow and sees some rapid cell division, it may slow down that functioning. Now, it's not going to kill the bone marrow. It's just going to slow it down, kind of turn the volume down, turn the speed down on it a little bit. And during that time, while the bone marrow is recovering from having been in contact with chemo, it's not going to be making as many of the blood cells that your body needs for its normal functioning. This is the primary reason why we check your labs preferably 24 to 48 hours prior to each chemotherapy treatment. Because what we want to know is if you got treatment over here and your next treatment is due over here, and your blood counts are going to go down right about here, we want to make sure that they're back up to normal before we hit you again with more chemo. Because if they haven't and we give you more chemo when you're not really ready for it, then you could become could get sick at that point. So, briefly, 3 different kinds of blood cells we talk about. Red blood cells, you probably know, carry oxygen and nutrients, giving all of your body's tissue energy. If you don't have enough of those, you don't have enough oxygen to give your body that energy, so you may feel tired and maybe have some dizziness or shortness of breath. Platelets have to do with blood clotting and preventing bleeding problems. So if you don't have enough platelets, you might bruise more easily or you are at a higher risk of bleeding. Now, the white cell is the one that we are most concerned about. It seems to be most affected by the chemo, and unfortunately, its primary function is to fight infection. So if you don't have enough white cells to fight infection, that means you're at a higher risk of getting sick with something else while you're on chemotherapy. So we're going to focus on that one. In the world of white cells, there's a number of different kinds. We focus primarily on the ones that are called neutrophils. Those are the ones that are mostly involved in fighting infection. I put this acronym ANC, absolute neutrophil count, in there. You don't have to remember that, but it'll be helpful because people are going to start talking about your ANC, which means when you come in, they want to see how many neutrophils do you have, and do you have enough today for you to get treatment again. So a low ANC is going to result in lowered immunity, and the problem with that is if you come in for treatment and your ANC drops below what we consider normal for you, we're probably going to have to delay your treatment until it can come back up again. If you get sick when your absolute neutrophil count is low, you're going to get sicker than you normally would, and that might require bringing you into the hospital to support you so that you can fight off an infection with additional help. Okay, an infection, an invasion of an organism that can cause you health problems. We'll just use that definition. The main symptom of having an infection is an elevated temperature up to above 100.4. Not 104, but 100.4 Fahrenheit or 38 degrees Celsius. Usually, if your temperature goes that high, it means that your body is generating heat fighting off the infection. So if you have a temperature that high, it may well mean that you already have an infection going on. Often, this is, you probably all had a cold or the flu before to have this happen to you. Usually it'll go along with something like a sore throat or a cough or shortness of breath, or maybe you feel chilled. Maybe you have symptoms of a urinary tract infection, maybe swelling or redness in an area. If you have a fever that is at that level or higher, then you'll see the number on your screen of who to call. Having an elevated temperature while you're on chemotherapy is something we want to know about immediately. We don't want you to take a couple Tylenol and say, I'll feel better in the morning, because you will feel better in the morning. But if you have an infection going on already, we've just lost 4 to 6 hours of time that we could give you intravenous antibiotics to help take care of it. So those phone numbers there, one's for the Cancer Center South Bay, the other one is for Cancer Center Palo Alto. Anytime, day or night, you call that number. Now during the day, it's not too hard to get a hold of a human to talk to say, I don't feel very well, what should I do? At night or on weekends, when you call those numbers, it's very easy for you to figure out how to be transferred to the page operator, who will ask you what you need. Tell them your name. Tell them you're a patient there. You've got cancer. You're on chemo, and you've got a fever. They will put you in touch with an oncologist on call. There's always an oncologist on call. May not be one that you know, but someone who has access to your electronic medical record and can be able to tell everything about whether we need to have you come into the emergency room immediately, whether you can schedule an appointment that day to see someone. All of that being said, if you feel really sick, if you're at home and you just feel awful and you got a temperature of 102, you don't have to call anybody. You can just go to the emergency room. If you're close to Stanford, of course, we'd love you to have you come to our emergency room because then we can take care of you. But if you live in the Central Valley or you live out of state, then you go to any emergency room. Every emergency room knows how to deal with a patient on chemotherapy who's what we call neutropenic, not enough white blood cells. But it is something that you need to take very seriously. Now, it doesn't mean that you have to take your temperature all the time. It just means you have to have a working thermometer. You know where it is. It's got a battery in it. And if you feel warm, then take your temperature. But please don't think that you have to worry and mark your fever, your temperature every 4 hours. It's not necessary. Just know that if you do feel warm, it's something you need to pay attention to right away. So, in addition, or I should say, rather than feeling scared, we would rather have you feel prepared as to preventing this from happening. And by far, as we've heard a lot recently, the best way that you can avoid getting an infection is washing your own hands. Often the infection you get is because you shook hands with somebody or you touched the doorknob or something and then you took a bite out of your sandwich and that little molecule got in your system, and that may be why you are now sick. So clearly washing your hands before meals, after using the restroom. Anyone in the household comes in and washes their hands, or these days using antibacterial gel. I tell patients to put some by the front door, the back door, have it in your purse, your car, your pocket. Just get used to using it a lot. And I think these days people are pretty good about using hand gel, so this will help you. If you do cut your skin, you're working in the garden or something, wash your hands right away. If you've got, a Neosporin or some antiseptic you can put on there. Stay away from people who are obviously sick. If you're on chemotherapy and somebody wants to come visit you, it's your best friend, and they said, well, I'm still coughing, but I know I'm not contagious anymore, you politely say, I will love to see you when you're not coughing anymore, because we don't want to take any risk that you would be around someone who's sick. Keeping your hands away from your face. We sit on the computer and we do this, and now it's just like putting an unwashed hand near your face. So try to keep your hands away from your face. Good personal hygiene, showering. If you want to use an antibacterial soap, you can do that. Wear gloves if you're doing any kind of housekeeping or gardening where you might prick your skin. Ask someone else to clean up with pets. I will say primarily pets are relatively clean. Cats are incredibly clean, even though they have usually a litter box in the house. I do have to tell people, don't kiss the dog on the face. Don't let your dog lick your face. Even though you rarely get sick from a dog, let's just not do that. Birds, actually caged birds, the droppings of birds are probably more of a concern than anything any other pet would have. So if someone else can clean the bird cage, that would be good. Avoiding raw food, raw eggs, sushi. If somebody wants to be extra careful, antibacterial wipes can go around every day or so and wipe off those things that everybody touches, the remote, the handle of the toilet, the door, that sort of thing. Avoid manicures and pedicures if possible. Use of masks, of course, these days masks are all over the place, but generally the concept here is that a mask is going to prevent, if someone else in the home is sick, it's better for that person to wear the mask because the mask does a better job of preventing that bacteria of getting into the air than it does of preventing what bacteria is in the air of getting into you. If you would like to wear a mask, no one's going to look at you cross-eyed if you do. But we generally don't insist that our patients wear masks. White blood cell boosters, you may hear about this depending on what treatment you're on. If your doctor feels that your white count isn't coming back up fast enough, there are some injections that we can prescribe that will stimulate your bone marrow to make more white cells, even though the chemotherapy is making it slow down. But if that's necessary for you, your doctor will tell you. And then, of course, flu vaccine, we want everybody to be up to date on their flu vaccines. Okay, hair loss. Hair loss is caused by chemotherapy drugs slowing the growth of rapidly dividing hair follicle cells. And again, it's not too hard to understand. The chemotherapy is circulating everywhere, gets up here where the hair is growing, sees that rapid cell growth as each one of those strands of hair is building the root, and it slows that down. So now you've got a little weak portion of each of those strands of hair right underneath the skin, primarily on your head. When that hair grows out, that weakened part is going to hit the outside world, and it's not going to have anything to hold on to, and your hair may fall out. Now, to be clear, not all chemotherapy drugs cause this side effect. So your physician will tell you whether or not you are at risk for this. Usually takes 2 to 3 weeks for you to notice any hair loss. The hair loss is primarily on your head. Some people do lose eyebrows, eyelashes, other body hair, but it's primarily on your head. We often recommend that you pick out a wig or a scarf or hats maybe before you lose your hair so that it's not as upsetting when you finally do. The Cancer Supportive Care Program does have resources for wigs that we can get for you without cost. Your hair generally starts growing back about a month after your treatment is stopped. The color and texture of your hair may be different when it comes back. I tell men who start treatment bald that they will not grow hair or they did not have hair before they started treatment. So you don't get a whole new head of hair after chemo. But sometimes your hair will grow back coarser, curlier, maybe more gray than it would have been before. And who knows whether it's going to stay like that or whether it's going to change. I used to see a pattern. I don't see a pattern anymore. Hair seems to have its own idea of what it wants to do after it comes back. We do have some options for using ice caps to reduce the hair loss by decreasing blood flow to the scalp. You can ask your provider whether or not the drugs that you're on, whether this would be a good option and how to do that. That technique is something that you will have to work out with how to do on your own. We don't have the resources. Most of our locations don't have the resources to provide that for you, but there are plenty of places that will help you figure that out. Okay, nausea. Often another one people think about, an unpleasant feeling that you're about to vomit. So chemotherapy has an influence on the stomach and the brain. You've got a little, I don't know what we still call it this, we call it the chemotherapy receptor zone, and it's almost as if when the chemotherapy hits it, it causes a nausea that sometimes is similar to motion sickness or car sickness or morning sickness. But then again, nausea can be caused by things like anxiety and stress. So nausea is a multi-layered side effect, so we really kind of have to approach it that way. Again, different chemotherapies cause different degrees of nausea, some none at all. Nausea may start during the first 24 hours, although we're doing a pretty good job of preventing that with anti-nausea medication. It can last for 2 or 3 days or more after treatment. It depends on what treatment you're on. Most important thing, prevention is key. You will be prescribed anti-nausea medication, and your nurse, either on your doctor's team or your nurse in your treatment area, or both, will go over those with you as to how to take them at home. When you come for your chemo, we nurses will give you anti-nausea medication just prior to your chemo, so we'll be in charge of getting you prepared. Most of the time, you don't have to take anything on your own before you come. There's a few exceptions to that, but most of the time, we'll just take care of that for you. Bring your prescriptions with you if you've had them filled before your first treatment. Then we can go over them with you so everybody's sure of what to do. One of the ways to reduce anxiety related to nausea is to know that you are prepared to deal with it if it happens. And also know that even if what you have at home to take doesn't help, you are never out of options. You call us and we'll come up with something. Nausea is most of the time a treatable side effect of chemotherapy, so we don't want you to be afraid of that. Other things that you can do is frequent small meals, staying well hydrated. A lot of our patients find ginger, whether it's ginger tea, ginger candies, helpful. Not instead of the anti-nausea medication, but in addition to. Guided imagery, relaxation techniques, hypnosis, acupuncture. Our patients find they don't really use those quite as much. They're out there, but most of the time we're pretty good with our anti-nausea medicine. Mouth sores. Some of the chemotherapy works on affects the rapidly dividing cells that line your GI tract, which actually include the lining inside your mouth. You're not as aware of this process, but those cells are being sloughed off very frequently, and new cells are being made behind them. That's why if you ever notice if you bite the inside of your cheek and you have a little sore in there, that it heals up really fast. That's because there's a lot of rapid cell division going on there. It's also the reason why some people get sores in their mouth from certain kinds of chemotherapy. Redness, dryness, maybe canker-like sores, little irritations in your mouth. The best prevention, and I tell everybody, just get used to brushing your teeth with a gentle toothbrush, saltwater rinsing 4 times a day. You can use a 1/4 teaspoon of salt or baking soda, or both if you want, in a cup of water, and just rinse and swish 3 or 4 times a day. And that's probably as good, if not better, than any expensive over-the-counter mouthwash. Drink plenty of fluids. If you do develop sores in your mouth, please let your doctor know right away, because we do have some additional things that we can do. Don't go to the dentist while you're on chemotherapy. If you haven't been to the dentist for a while and you've got time to get a good dental cleaning before you start chemo, that's great. But please avoid doing any routine cleaning while you're on chemo. If you have a dental issue that needs to be dealt with, talk to your oncologist first as to when the good time would be to deal with that. Constipation. There are a few chemo drugs that cause constipation, but most of the time patients on chemotherapy have problems with constipation because of an anti-nausea drug that we love called ondansetron or Zofran. I would say constipation surprises a lot of patients in terms of side effects, because people say, I've never been constipated before, I'll be fine, and you're so focused on other things, it's hard to remember something that normally happens that doesn't happen, right? So you may, after 3 days, you're going, oh, I'm not nauseated, I'm feeling okay, and then suddenly you've got a stomach ache and you're worried what's going on, and then you think back and go, I haven't had a bowel movement for 3 days. So we want you to be aware that having a regular bowel movement will go a long way to keep you from having any unnecessary additional discomfort while you're going through chemotherapy. If you're on pain medication, you all know that pain medication can cause constipation as well. Again, if you're not drinking those half a gallon of water, if you're not as active, and all of those things can happen, you are at high risk for constipation. And if any of you have ever been really constipated before, it is not funny. It's very uncomfortable. And sometimes getting over it is just as uncomfortable as well. So, treatment. High fiber foods. Some people find a prune every day is all you need. Bran cereals, vegetables. There's the water there again. Exercise can be walking, 20 minutes of walking a day. I really encourage you to have walking be on your list of things you have to do every day. If you got a bad day, just don't feel like it, just 1 lap around the dining room table and say I did my walking. Stool softeners, Colace or the generic version Ducosate, and then laxatives, which we use Senna and Miralax or Smooth Move tea if you want. Smooth Move tea actually has Senna in it if you'd rather have a cup of tea than a pill. We'll talk about this with you depending on which chemotherapy you're on and how much Zofran you have to take to prevent your nausea. Diarrhea is less common. There are a few drugs that cause it, but the concern here is if you think you're having diarrhea because of a chemotherapy drug, but maybe you actually have a GI bug or even C. diff or something. So we do want to know if you're having frequent diarrhea. I think we say 5 or more liquid stools in a 24 hours, we just want to talk to you. We would always rather have you call us than sit at home and wonder whether you should call us. Treatment, Imodium, more fluid, low fiber foods, that sort of thing. Peripheral neuropathy, a numb, tingling feeling in your hands and feet. Peripheral means those things that are on the periphery of your central nervous system. So you've got primarily your hands and your feet. There are some drugs that for some reason tend to damage those little nerves out there that can cause some, usually numbness or tingling. There's one in particular that causes hypersensitivity to cold. That's oxaliplatin, but most of them that have this, it's a numb and tingly feeling. Can happen like in this finger, but not this finger, and over here, but not. It's really weird the way that it can manifest itself. It increases after multiple treatments, whereas usually if it's going to happen, it's going to happen within the first couple of days, and then it'll go away. But it's fair to say that when it comes to peripheral neuropathy, we can't guarantee that if you have this side effect that it will ever completely go away. The people I know who've been through chemo and still have peripheral neuropathy say, yeah, it's still there, it's numb, but it doesn't really bother me. So I don't want this to scare you. We don't have good medications to treat this. Probably the best thing we have is preventing it these days, which is the use of cold on your hands and feet to prevent, again, to restrict the blood vessels in your fingers and toes while the chemotherapy is going in. So to do this, patients sometimes purchase these frozen mittens and socks that you can keep in the freezer, and then you put them on your hands and feet 15 minutes before the infusion that's causing that potential side effect is going in, and then 15 minutes after it's done. You do need to get multiple sets of these. We can't let you use ice to do it. It's just not safe to be putting your hands directly into ice. But we can give you some more information about this. But a lot of patients are now using this to help prevent peripheral neuropathy, and it seems to be working. All right, nutrition. Just a few things about nutrition. One of the things I often recommend is to ask for a referral to one of our dietitians. Our dietitians are specifically trained in diet as it relates to cancer patients. They only work with oncology patients, and they are phenomenal. They are up to date on the latest of everything. They know the answers to all of the questions about, I heard I can't have sugar, I heard I can't have red meat. What's the reality of all of that? And they will tell you the latest on the science behind that sort of thing, as well as help you figure out how can you, maybe you're vegetarian or you have certain dietary restrictions and you're concerned about how you'll be able to keep your nutrition going. Even if you have no pre-existing nutritional issues, I highly recommend asking for a referral to a nutritionist. They're great. In general, people's appetite tends to decrease while you're on chemo, and sometimes the chemo can alter the taste and smell of food. When you put those two things together, people tend not to eat. It's very hard to eat when you're not hungry, and it's very hard to eat when food doesn't taste good. And so when you're used to food being something you enjoy, something you do socially, something that has meaning, something you look forward to, and now it is unpleasant and you don't want to do it, yet we're telling you to do it anyway. We recognize that that's very difficult, but we also want you to know that we really want you not to be losing weight while you're on chemo. When you lose weight, it's a stressor on your body. It uses up reserve energy sources and makes your body just work harder overall. We want to give your body every advantage to let the chemotherapy heal the cancer problem. And we don't want it to be dealing with anything else that we could avoid. That's why we pay such close attention to nutrition. Okay, so in general, well-balanced meals, we probably all know what that means. 8 to 10 glasses of fluid a day, that's what we've been saying before, 2 liters or 1 gallon. It doesn't have to be all water. That can be fruit juice, decaffeinated tea, bubbly water. You can We generally say you can have 1 or 2 cups of caffeinated beverage a day. Anything beyond that, you're going to need to take additional fluid to make up for it. Because as you probably know, caffeine can be a diuretic, which means it might make you urinate out more fluid than you take in. So we're not telling you you can't have coffee unless your physician does, but we just don't want you to have your half a gallon of liquid be coffee. Ask your doctor about drinking alcohol while you're on chemo. In general, alcohol is metabolized by the liver, and it's very difficult for the liver to do that. So we would probably, all things being equal, we would say better not to drink while you're on chemo because we want your liver available to do other stuff. Yet we also know that there's a quality of life issue here. And if you finally get to a ball game and you can't have a beer, that's just going to really make you upset, then probably it's okay to have a beer. Your daughter's getting married and you want to toast champagne, don't do that to yourself. So some of these things are in moderation. However, please talk to your own physician about this first. Certain types of cancer, we're more strict about this than others. We talk a little bit about sexuality. This is mostly something that we want you to know is an issue that we're not very good at talking about, but we have patients who come back later and say, I wish somebody would have told me. So we put this out on the table for you. But for some people, losing your hair, losing weight, being anxious and fatigued, plus hormonal changes might go on, are going to be part of what affects your how you see yourself sexually and how your ability to enjoy that part of your life. And we know that there may be some risks in this area. So this is mostly the permission slide to talk to your partner about this, that this may be a difficult thing for you, but so long as you're talking about it, you're probably going to be a whole lot better off than if you're not talking about it. Yes, it is okay to have sex while you're on chemotherapy. Use condoms if it's during the first 48 hours. It's clearly not okay to get pregnant while you're on chemo. Fetuses are rapidly dividing cells. We don't want a pregnancy to happen while you're on chemotherapy. Some people do have a lowered sex drive during chemo. That can happen. Women may have vaginal dryness that could be uncomfortable. We do have some resources there listed if you want to talk about how we can either prevent problems here or talk to you about problems that you may develop while you're on your treatment. Okay. Actually, I should go back and talk about reproduction a little bit more. Depending on your treatment could cause either temporary or permanent sterility. So that is definitely something you want to talk to about your provider with, particularly, obviously, if you're in those childbearing, child-producing ages, to see whether or not there's a reason to do any sperm or egg banking before you start your treatment. A few resources there. A little bit about chemo brain. You may have heard people talk about chemo brain. It's still we're beginning to understand a little bit more about this. It's basically a fog that a lot of people who are on chemo talk about, kind of like menopause, they say. I just can't quite remember what I was going to say. Word finding issues. Symptoms can be very subtle. It could be because going through cancer treatment is very stressful and distracting, and that means you may not be on the top of your game cognitively. It could be there are certain drugs that we think actually cause this as a temporary side effect. We're not going to do any permanent brain damage to you with chemotherapy. Treatment, keep a planner, make a list of questions. This is a big one. Make a list of questions when they come up when you're home that you remember to ask your doctor about. Because a lot of times we'll see patients when they're getting chemo and they've just come from their doctor's office and they say, oh, I forgot to ask him about this. And clearly when you're in that room with your physician or your provider or your nurse practitioner, they have your full attention. So when you have questions for them, it's best to ask them when you have them in person. Ask them anytime, but if you come in and you go, okay, I've been thinking, I got some questions I guarantee they're going to sit back and go, let me know. Let's just deal with this now. The more you know about what you're going through, the more you understand and you're part of the process, the better this is going to go for me. The less you want to know, then if you do the, I don't want to know, just do it to me and tell me when it's over, those people tend to not do as well. Your body and your mind want to be integrated and go through this together. So try to keep track of those questions. Exercising your brain, whether that's Sudoku or crossword puzzles or any of that, or read. Reading is great exercise for your brain. A little bit about emotional impact. It's normal, absolutely normal, to feel emotional distress when you're dealing with a cancer diagnosis or going through chemotherapy treatments. Expect that you're going to feel emotional if you haven't already. Now, obviously, some people are more prone to being emotionally distressed than others, but generally people say they have some good days and they have some down days. When you got a down day, don't beat yourself up. You're going to have some good days again, but know this is completely normal for this to be a stressful, anxiety-provoking experience. Roller coaster is a word that patients use a lot. Be gentle on yourself in terms of how you feel. It's okay and completely normal for this to be a rough go emotionally for you. Coping strategies, schedule moments of joy for yourself. Think of those things that you really like to do, that you're happy when you do them. Maybe you don't even think about scheduling that sort of stuff normally, but when you're going through chemotherapy, maybe it's driving to the beach and sitting on the sand for a little while. Put those things on your calendar. Ask those friends and family members who have said, if there's anything I can do, let this be one of those things that you could do. Because when you schedule those things that give you joy, you're more likely to have a little more joy in your life. If you don't schedule them, people tend to have a tendency to isolate and stay alone and just want to sit in a corner. And we completely understand. But if you've got something on the schedule that is positive for you, that'll help you get through this. Exercise makes a whole lot of difference if you can keep that going. Journaling your thoughts. Sometimes when you write stuff down, it gets it out of you and onto a piece of paper. And then setting goals and rewards for yourself. I like to encourage people to think about, your doctor's going to say, well, you're going to be on chemotherapy for 12 weeks, for example. So after 6 weeks, plan something, a hump day celebration, whether it's with family or make a phone call or take a picture of yourself with some balloons or something and say, I am halfway there, doggone it. I can do this half. Because the second half may be harder. So when you look back at that photograph or that memory, you're going to go, okay, I didn't think I could get halfway through. I did. Maybe I can do the other half as well. Now, there is a place for professional help. If you're finding that you're not able to get out of bed, if you're feeling signs of depression, you don't want to come to the doctor's office, anything that is out of the ordinary in terms of your level of sadness and stress, please consider getting some professional help. Each one of your doctors has a social worker that works with them. And those social workers are like the first line of people to figure out how we can help you to feel better. They also only work with cancer patients, and they are incredible experts at how to help with some of the emotional concerns that you or your family are having. And I think that they're a great resource. They can get you connected with someone to do some regular talk therapy with you. Maybe some medication would be helpful for some antidepressant medication would be helpful for you while you're going through chemotherapy. Don't worry if that's something you've never wanted to do. You may, if you want to just let that go for a little while and try that, that's something that that might be helpful. Okay, preparing family and friends. This is kind of a family disease, as I'm sure that you have found already, that if you're the one having the diagnosis, those people who are closest to you are feeling it too. They're feeling something different than you are, but they're feeling it too. So we think about cancer as affecting that whole group, you, your family, and we've also found that sometimes stress levels in caregivers, I'm going to put the word spouse or partner in there, that group are often even higher than those of the patients. There's something about wanting to be the one to make it okay and not wanting to say to your wife who has cancer, I'm really scared. This is really hard for me, because you don't want to make it any harder for her. So that puts a different level of burden on that individual. So we realize that we need to be able to support everybody. I don't know if it's on this. We have a great resource for this called the Caregivers Workshop. You will, if you haven't received or looked at the website to see the resources for workshops that we do have one particular one that is just for family members, no patients allowed, only family members, where you get to come and just say whatever you want to say. And no one's going to judge you for saying, I'm just so ticked off at my wife for getting breast cancer. You know, that sometimes you just need a place to say that. Let people help you. You know your friends are stressed out as well. Some of us are not really good at asking for help when we need it. We'd much rather be the one to help somebody else out. But at this point in your journey, this may be a time to let those people in a little closer. Let them do some simple things for you. Because I tell you, if you don't give them something to do, they're probably going to come up with something to do, and they're going to bring you soup until you're sick of soup or something. You know, so if you say, well, you know, I can't think of anything right now, but when you're on your way to the grocery store next week, can you call me first, because I may be running out of milk, or something like that. But you could even be thinking beforehand, what are some little tasks that I could give those who want to something to do to help me? Because I'll tell you what will happen through this whole thing is you're going to find out who those people are who are going to stick with you through this, and it may surprise you who those people are who really know what to say or are not afraid to make a mistake in what they say. So expect to find your circle of support being intensified and embittered as you're willing to let people help you. I'm also a big fan of these personalized patient websites. The one most people know of is Caring Bridge, and what that is like, it's on the slide here, is either the patient or someone on behalf of the patient will make up the website for you, and you can say as little or much about what your situation is. So, and then people who are invited into your Caring Bridge page will have a little password, so you don't put it out there for everybody to see. You just invite your circle, and then whenever you put something new in there, it automatically tells them, hey, there's something new on Susie's Caring Bridge page. And so you can write how you're feeling, or maybe your son can write how your treatment went. So you don't have to call all those people who said, please call me and tell me how it went, because you just may not want to do that. And this way, it helps your caring community be up to date with what you're going on. And there's ways to set up bringing meals and putting photographs. Been on a number of these with my friends, and I find it very connecting for me as someone who is caring someone maybe across the country who I wish I could be with, but it's a great way for other people outside of your physical area to be engaged with what you're going through. A little bit, we're almost done here, a little bit about the Cancer Supportive Care Program, which is the group that organized this particular class. Again, if you probably found this on their website, so you can see all of this on their own website, but we have phenomenal opportunities for all kinds of supportive programs for you and your family. The exercise consultation is really helpful. They can do a one-on-one even remotely if need be to help you figure out what kind of exercise will work for you in your particular situation. They have mindfulness meditation, yoga classes, Tai Chi, journaling, art, a lot of support groups. So those are the numbers down there of the 3 different I got multiple sites. South Bay, Palo Alto, Valley Care, Pleasanton. All of those are places that you can contact for this sort of thing. Other resources and support that is available to you. When it comes to the internet, we clearly want to encourage you to go to those big reputable sites like American Cancer Society, National Cancer Institute, National Cancer Center Network. Those are the most reputable ones. You will find all kinds of other things that are also quite good, but sometimes it's hard to tell when you're looking at something on the internet whether it's how believable it is. Some people find they just want to stay away from the internet altogether because once you start looking at it, you find more and more things and you get more and more confused. But we do know that there's good resources out there. We do have a Stanford Health Library, both at the South Bay Cancer Center and then here in Palo Alto. They are phenomenal. They're the most underused resource that we have. They're health librarians who you go in and say, I'm getting Taxol and I really want to know some more about it. They will find you books and resources and movies for your kids and how to talk to children. They're a phenomenal resource. Let's see, what else have we got going here? Okay, so this is the slide I'm going to end on. This is just a brief picture of the 3 different main sites that we have right now. I realize we do have some out in the East Bay that don't have pictures on here. So our primary infusion area, our largest one, is in Palo Alto here at the Stanford campus. We have an infusion area in Redwood City, and we also have another very large infusion area in South Bay and San Jose. Your primary, we will try to schedule you at the one that you want to be at, but you need to understand that we have a lot of volume, and sometimes the timing that you want won't be available at one site, and we may have to put you at another, but we try our very hardest to get you to get at the treatment that you want. I'm sure I haven't answered all your questions, but you will have opportunities between your provider, your nurse coordinator, and then your treatment nurse, like myself, will be able to answer any questions that you want. So if you would like to, we also have this class live. Right now we're doing it remotely, but if you want a live going through of these slides where you can ask questions, you can also do that as well. So thank you for watching, and I hope this has been helpful for you.